before we commence, I have to make a couple of announcements. Firstly, Minister of Health, Makhdoom Shahabuddin, Sajjada Nasheem of Dargah Aliya Mayu Mubarak, situated at Mianwali, Qureshi, District Rahim Yar Khan, had accepted to be the chief guest today. I have had the occasion to visit his hometown and see for myself the good work the family is doing to redress the grievances of the poor within their constituency. Now, as Minister Health of the Federation, he shoulders a far greater responsibility. He must address the issues of all of the poor of the country. Alas, man proposes, but God disposes. Even the Sajjada Nasheem could not change what God willed for us. In addition to the minister's commitment, Almighty sent us the man who is in charge to deliver health to all on behalf of the government of Pakistan, Professor Rashid Juma himself, the Director General of Health. He's here to preside over the proceedings with the blessings of the Sajjada Nasheem and above all, Allah subhanahu wa ta'ala. Sir, we are indeed honored by your presence here, and we, as much as we respect the exigency of the ministers to stay back in Islamabad, thank you for taking the time out to be with us. Ladies and gentlemen, believe me, Professor Juma is a doer. Secondly, we have agreed that in her concluding remarks, Dr. Sania will not be making any speeches. She'll be happy to respond to questions that any of you may have. Paper and pencils are available with our volunteers, and they'll come to you during the proceedings. Some of you have read the book, you have questions. Some of you may hear reviews from panelists here, and you may have some questions. Please send them in. Dr. Sania will be happy to respond to them. If time permits, we'll take even questions from the floor at the end. But if you want to have a chat with Dr. Sania Nishtar, and a more detailed one, please join us at T2F, the second floor, many of you may know, at 1 p.m. tomorrow. T2F address and details are available at our desk. Ladies and gentlemen, my first interaction with Dr. Sania Nishtar occurred in November of 2005, a few weeks after the October 2005 earthquake disaster hit Khyber Pakhtunkhwa and our administered Kashmir. Today, with 2020 hindsight, I can safely say that she gave us pages out of her then unwritten book, Joke Pipes, so that we could successfully embark upon public-private partnerships to set up rehab centers in the affected areas to serve the physically challenged persons, amputees, and spinal cord injury persons. Alhamdulillah, the Child Network, which many of you have supported and funded, thrives today and is operating on a self-sustainable basis. Our most recent initiative, titled Janam, anchored also in Murshid Hospital and Healthcare Center, was launched last year with the support of a select number of Rotary clubs of Karachi to help improve maternal health in Pakistan. Here again, Dr. Sania shared pages from her book before it went into print to guide us in setting clear, achievable goals to help reduce maternal and neonatal mortalities. In this instance, we have the support of our local obstetrics, gynae, and midwifery professional bodies and associations, as well as the Royal College of Obstetricians and Gynecologists, UK. I'm very pleased to see some of the leaders of maternal and child healthcare institutions in the audience, and I was also delighted to learn that President of the Rotary Club of Karachi East, Mr. Nisar Sheikh, accepted Mrs. Amina Sayyed's invitation to this book launch in lieu of their weekly meeting and has come with his club members. Thank you all. Ladies and gentlemen, this rare privilege to co-host an OUP book launch is indeed an honor for me. When I read Sania's dedication, and I quote her words, "Choke Pipes is dedicated to the silent and unjustified suffering of millions of individuals for whom the right to health remains unrealized, and whose lives I strive and aspire to touch." Unquote. If I were to introduce the author and her accomplishments, I will not be done for another hour at least. But that is so true of all our panel speakers who are here present today for the launch of Joke Bites. Without much further ado, I invite Mrs. Amina Syed, Managing Director, Oxford University Press, Pakistan, to deliver her welcome address. She is our First Lady CEO of a multinational corporation in Pakistan, and if I'm not mistaken, is the only one today. OUP, the short form of our enterprise, continues to enrich the lives of many in their thirst for knowledge. Please welcome Ms. Amina Syed.
Thank you, Mr. Hamid Jafar, and thank you very much for co-hosting this wonderful event with us. It's been a pleasure working with you. We've been planning this and talking about it, and it's been a wonderful experience. Dr. Ishrat Hussain, Dr. Bille, the WHO representative in Pakistan, Dr. Tipu Sultan, Dr. Sanya Nishtar, Mr. Javed Jabbar, and our distinguished chief guest, Dr. Rashid Juma. Thank you very much for joining us today, and I would especially like to thank Professor Rashid Juma because he's come from Islamabad to be with us today, and he's actually come straight from the airport. So thank you very much for taking the trouble to join us. I think your presence here today shows your commitment to the subject, and I think to books in general, because I think you are one of the best buyers of Oxford books in Pakistan. Whenever I meet Professor Rashid Juma, he always has something nice to say about some of our books. Thank you very much for your support and encouragement. Distinguished ladies and gentlemen, Assalamu alaikum. I'm delighted to present another Oxford book, and this on choked pipes, reforming Pakistan's healthcare systems by Sanya Nishtar. This is a significant work in which the author has provided the first consolidated review of Pakistan's health system and has set forth a roadmap for much needed health reform in Pakistan. The present healthcare system in Pakistan is plagued with a plethora of problems, and Dr. Sanya Nishtar has covered all of them. The country's insecure economic state in which productivity has plunged owing to a variety of reasons in the prevailing law and order situation. Strict modes of tackling the problem. Of course, the problem itself is the outcome of multiple factors such as scarcity of monetary and human resources, inefficiency and insensitivity, as well as political instability and lack of vision. There's no subject that Dr. Sanya Nishtar has not covered in this book, including corruption, cronyism, nepotism, and the usual list of problems that plague the system. There's no doubt that the healthcare system in Pakistan needs far-reaching reforms, and it's clear from the work that Dr. Sanya Nishtar understands the problem in depth. Her analysis of the conditions and her scholarship are really impressive. She's highlighted the deficiencies of the service delivery system, imperfect access to essential medicines, and deficiencies in the laws that pertain to regulation and distribution of healthcare essentials. Moreover, she has comprehensively discussed and suggested in this book realistic measures for improving the situation, which are actually global in their relevance. Dr. Sanya Nishtar is the founder and president of Heart5, an influential NGO and think tank on health. She has published more than 100 articles in various journals and has written 4 books. She is a fellow of the Royal College of Physicians in London and holds a PhD degree. She has been widely quoted in the media and has received many national and international awards. Her NGO, Heart5, is recognized as a model for replication in other developing countries of the world. Just to give you an idea of our publishing program, I'll mention some of our recent and forthcoming books. Early Childhood Development from Understanding to Initiatives, edited by Bilal Iqbal. Islam, the State and the Population, by Gavin Jones and Mehtab S. Karim of the Aga Khan University Hospital. Nutrition Interventions for Maternal and Child Health and Survival by Zulfiqar Bhutta. wars, insurgencies and terrorist attacks, a psychosocial perspective from the Muslim world by Dr. Uneza Niaz. So it's a great pleasure for me to welcome our distinguished speakers here today, and thank you, ladies and gentlemen, for joining us. Assalamu alaikum.
Our first speaker is the World Health Organization country representative in Pakistan, Mr. Khalif Billi Mahmood. He has responded to earthquakes, floods and conflict in our country, where some 8.5 million people have been displaced by disaster or insecurity in the past 5 years. In addition to humanitarian emergencies, under Mr. Billi's round-the-clock guidance, his team also promotes primary health care and immunization. I quote Mr. Billi from The Lancet: "Health is an undeclared, sustained war because we are fighting disease and illness and lack of awareness and understanding." Unquote. I don't think the gentleman needs any further introduction. Please welcome Mr. Billi.
Bismillahirrahmanirrahim. Honorable members, distinguished friends, ladies and gentlemen, assalamu alaikum and welcome. I am indeed delighted to be here today, and I have certainly made a point for myself to be in this August gathering. 3 days ago I was in Geneva, and I was afraid that I may miss the flight. I got it. Today at 6 o'clock, I traveled to Nawabshah. I came back again to make sure that I don't miss this very important gathering. The reason being that we are indeed witnessing a very unusual moment, which the life and dedication of one person has infused and influenced an entire nation. And indeed, the world. Because we in WHO consider Nishtar as one of the great scientists of public health who has given to the world community with her expertise and knowledge, and have always tried hard to defend the cause of those who do not have the opportunity to speak out in such occasions. I take the floor this afternoon to express my deep appreciation and recognition of this monumental work undertaken by Dr. Sania Nishtar in writing a book that interfaces through 60 years of Pakistan's experience in dispensing health development. The book depicts the sincere and laudable attempts made to improve the health systems of this country, the challenges faced, and the successes and failures experienced while traversing this difficult road of social transformation and reform. Through her book, Nishtar has enabled us to capture at a glance the major lessons to be learned and the opportunities available to avert the mistakes made in the past. Through her wide experience of national and international public health, Nishtar has not attempted to give us an isolated snapshot about Pakistan's health development, but has interfaced her analysis the global history of public health, placing WHO at the center, at the reference point for advocacy for universal coverage, essential primary health care, equity, and quality in providing care.